Hi, I'm Julian. I'm a physicist at Oncology Systems Limited, and I'm just going to give a brief overview of the IBA myQA proactive system. So, myQA proactive is a comprehensive risk management software that is all browser based. This is the landing page that I'm on now, and you can see we've got this list of all of the different risk assessments that have been performed. And alongside their titles, you can see a summary of their failure modes. We'll get onto that in a minute. So the failure modes, we've got a total number, and then we've got a breakdown of which failure modes are acceptable, on tolerance or out of tolerance, and the overall number of patients affected. So let's say we want to start a brand new risk assessment from scratch. What we can do is click this plus risk analysis button, and then you enter the details. So we'll say it's for EBRT, and you can define the number of patients per year, the period for your cost calculations, and your currency, depending on your clinic. You can also set a due date, so this will automatically prompt you when there's a scheduled risk assessment for review, and you can put version notes. So for instance, we can put version 1.0 test. So if I save that, it will launch me into a blank slate, and we're in the FMEA tab. So FMEA, for those of you not sure, is failure modes and effects analysis. It's basically just a very comprehensive and systematic way of performing a risk assessment. And so to do this, you go through your entire workflow and you add each individual point where something might go wrong. So let's have a little go at this. If I click this edit button, then the first thing I can do is add a step. So these are the general steps to your process. I'll say pre-treatment imaging. And you can say what percentage of the overall number of patients are impacted and how many times each patient will go through this step. But we'll leave that as one. Then I'll add treatment planning. And again, you have these options, but I will hit save. Now, clinically, you would go through and add each different step. But let's say we want to add a failure mode within treatment planning. So if I click this plus failure mode button, and maybe the failure mode I want to add is incorrect patient image imported. And I'm asked to give the cause, so perhaps the cause is just a mix-up of notes. Now you can choose which step to associate this with, so you can click this drop down. This one is associated with treatment planning, so I'll leave that as is. And then within the effect, you say what could happen if this failure mode were to occur. So in this case, you could have a severely incorrect dose distribution. But you see there is a drop down here. Now, one option you have is within each different risk assessment, you can actually define all of the different effects in advance. So for instance, you could have them as a sort of hierarchy. You could say inconvenience, radiation harm, non-radiation harm, etc. Or you can enter each one of them manually, which is what I've done here. And then below, you're asked to give the severity. So the worst case of this, the severity would be very high. The occurrence you would hope is very low, and likewise the detectability is very high with the initial preventions and barriers we have in place. So our initial preventions are things that should stop this happening in the first place. So I'll say initial check of notes should always be done prior to an image import. And then the barrier is the thing that says if the prevention fails, what is in place to stop this getting through to impacting a patient? So here, this might be second check of plan, which always takes place already. So once I save this, you can see I get this nice summary of my failure mode with the title and the various statistics I've entered. You also get the RPN, which is the risk priority number, and it's just a multiple of the different numbers, and the overall patients per year you expect to be impacted by this failure mode. So this is how I'd start from scratch, and obviously clinically I would build up a whole workflow from this. But what if I want to use a template? So if I go back home IBA provides a number of different templates that just let you hit the ground running. They're developed with clinical partners, and they're populated with common workflows and failure modes and quality measures. And then all you need to do is go through that and match the specifics to your department. So to use one of these, I'd go on import. You can download the templates from the website. So if I click this IGRT one, and it will ask me to just check the file for errors, and then it will ask me to give specifics for my department, again with patients per year, etc. But if I just say I'll import this, then what I get is a pre-populated list, again within this FMEA tab, of all of the different failure modes within this process. And again, you can jump into each one and double check the preventions and barriers and ask any that are in place add any that are in place in your department. So that is how I would start a new risk assessment, but let's jump into one that I've already populated. So I've got this adaptive radiotherapy one, and you can see I've got a nice long list of all of the different failure modes. And if I choose to, I can display this as a flowchart. And I can jump into each sub-step of this process to see the flowcharts of that step. So this is the flowchart of imaging in radiotherapy, it's got some nice art done to it, which you have the option to do. The basics of the flowchart will automatically be synchronized with the table view. But if you want to, for instance, to be able to present it nicely to your colleagues or include in a write-up or a report, you can add little bits of art to show the process that much better. But if I go back to my list of failure modes, and you can see each one has this status next to it that I've talked about before. But this one's interesting. So here we've got a red cross pointing to a green tick, which is currently failing, but there's something that can make it a pass. So if I expand the details of this and I go into the barriers, you can see that currently we have this barrier which is detected by chance. But just that barrier is not doing enough. So just that barrier is leaving us with this RPN of 600. So what we've got here is a potential barrier. Every time you add a barrier or a prevention, you can say whether it's actual or potential. And if it's potential, it will tell you what would be the case if you were to implement it, but it will still keep the old statistics as well. So here we've got the cost of that barrier, and we've got the fact that it only has a 10% miss rate, and that moves our risk from unacceptable to acceptable. Now, what can you do? You go through a whole workflow and you take each different failure mode and add potential preventions or barriers. But what you end up with is a long list of things that you could implement. And there's a reasonable chance that within your department you won't have the freedom to do all of that, certainly not at once. And that's where this cost and benefit tab can come in. So if I jump into cost and benefits, you can see that I have all of the different measures, that's preventions and barriers, that I have proposed implementing. And where one of those measures would address multiple different failure modes, they are all grouped. So you have this nice feature where the total potential detrimental cost of the failure modes that can be addressed by a single measure is grouped. And then what you have on the right here is the cost to the department. Now you can do that either just in terms of the number of patients affected, but you can also, if you choose to, do it in terms of the event-related cost. For instance, an estimate of the reputational cost to the hospital if this failure mode occurs. So you get an event-related saving related to that. And then you get the non-recurring and the recurring costs, so you can easily compare for each one the overall saving compared to the overall cost. And you have all of these displayed side by side, so it's very easy then to have a review of all of your proposals and choose which one to implement. So this can be really nice both for deciding the most efficient use of your resources within the department, but also actually for helping you to build a business case and show that you have rigorously analysed the most effective tool for the job. So that's kind of the prospective nature of myQA Proactive. But one of the really nice things in myQA Proactive is an upcoming module which is already being tested in departments called the retrospective module. Basically, this accepts that a risk assessment is only as good as the estimates that go into it. And oftentimes a risk assessment is performed and then we never really go back to it and make sure that it matches the data from reality and update it accordingly. So myQA Proactive Retrospective module introduces this feedback loop. So to demonstrate this, I'll go into a different risk assessment. I'll go into this UK health one. And again, we've got this nice list of all of our failure modes. I'm going to scroll down to 7.10. And we've got this summary, but over on the right, you can see there's a button that looks a bit like a graph. And what this button does is it links us to the statistics tab for this particular failure mode. Now, I'm going to choose to display my data yearly and cumulatively. And what you can see now is we have these three plots. The blue dots indicate my prediction of the number of events in my initial risk assessment. The red dots are what I have actually seen to be the case, and the yellow line, I can change that here. So that is a prediction edited within this tab. So what I can currently see is that I've had many more occurrences than I expected in my initial risk assessment, which means that my prevention isn't as good as I expected. So if I edit my prevention and I say, okay, let's change that to 0.45 perhaps, now I have a much better match with my current prediction against real events. But over here on the near events versus events, I've still got this mismatch that shows that I'm actually getting more events than I'm predicting and less near events, which means that my barrier isn't picking up these errors. So my barrier is also less effective than I expected, so I'll go over here and change this to 35% missed. And that makes a much better match over on the near events and the events too. So I can have a lot more confidence in the prevention and the barrier effectiveness than I did before. So what I now have the choice to do is to save that, and it will produce an updated version of the risk assessment. And once I've been through the various different incidents, I can then go through and check whether the status of any of my risk assessments, of any of my failure modes, has changed from acceptable to unacceptable, in which case more work might be required to bring that down. It's worth saying at this point that you can perform your incident reports within myQA Proactive, but if you have a pre-existing system in the department, such as Datix, you can also use this. So Datix allows you to export all of your incidents, and then you can import them into Proactive, and it's a simple process of assigning each incident to a failure mode, and then you'll have all of the statistics needed to go through this process. But however you get it, what you end up with is this reassurance that your initial risk assessment is being reviewed against real-world data, so that nothing is irrelevant or out of date. And that's pretty much it for myQA Proactive. If you would like a demo, please do get in touch and I'll be happy to arrange a visit to your department. Thank you.